The bill by Senator Talina Nelson notes that more than half of all local prescriptions are for opioids, but only 65 of 392 doctors who can prescribe controlled substances are registered to the Prescription Drug Monitoring Program database. Public Health's Division of Environmental Health Chief Tom Nadeau says they support mandatory prescriber registration.
This will result in improved patient care and management. Individual practitioners have a professional, lawful, and ethical duty to ensure controlled drugs are prescribed and dispensed in a manner that takes into account the nature of the drug being prescribed, the established medical standards for prescribing such drugs, and that there is a legitimate medical purpose for treatment using these drugs.
But Gary Schiff, a patients' rights advocate, says the mandate is not necessary. He opposes what he believes is an unnecessary government intrusion into what should be a private matter between patient and physician.
The prescription drug monitoring program was set up to have the firewall at the pharmacy. If you go into a pharmacy with a Schedule 2, 3, 4, or 5 medication, they must, by law, access your history and see if you're doctor shopping, how many prescriptions. And if they don't do that, they won't be able to continue to order those drugs.
Public Health's Nadeau disagrees.
It starts with the prescriber. That's usually the physician. They're the one who write the prescription. So I can't say that this should be just placed responsibly given to the pharmacist alone. I think this should be a whole healthcare community effort. Everything from the prescriber to dispenser, to the public, to law enforcement.
But Schiff believes it's a solution looking for a problem.
Now, I also believe strongly that the system we have is working. I don't see statistics where we're seeing prescription drug abuse on the street, people, stealing drugs, overdoses. That's not Guam.
The bill revises a previous measure introduced by Senator Nelson in 2020. For Guam's News Network, I'm Nestor Lecanto.